The Senate unveiling its Obamacare replacement bill. Among the key changes to the House's legislation, Medicaid cuts, or at least a slowdown of the expansion. NBC News reports that 4 Republican senators will not vote for the bill, at least in its current form, although they've said they're open to negotiation. Joining us right now is the Health and Human Services Secretary, Tom Price. Mr. Secretary, thank you for being here today.
Good morning. Wonderful to be with you.
Okay, so from my understanding of the bill, it seems like there are a few major provisions. That the bill would end the mandate to require individuals to buy insurance. It would end some of the Obamacare taxes. It would reverse the expansion of Medicaid that's pushed out there, and for the first time, it would be limiting states, the states' funding, federal funding for Medicaid. Are there other things that you want to point out about it?
Yeah, I think the important thing to look at is that what this will do is to actually stabilize the healthcare market. Right now, we've got an individual and small group market in healthcare that is literally collapsing before our very eyes, where you've got issuers pulling out of the market. You saw Anthem pulling out of, saying they're going to pull out of Wisconsin and Indiana next year if things don't change. You've got prices going up, premiums going up, deductibles, making it so that individuals have insurance cards but no care. And so what this will do is stabilize the market. We've talked to issuers about this, and many of them have told us that they are interested in getting back into the market, and that's important for your listeners. But what it will actually do is make it so that patients and families and doctors are going to be the ones in charge of health care and not Washington, D.C. So it's a remarkable improvement over where we are right now, and that's the important thing for people to appreciate.
Secretary Price, I hear your concern that there have been all these insurers who have stepped out of the marketplace, that there are a lot of counties that are going to have no coverage offered under the current law as it stands. But part of the problem was that look, it was really difficult for the insurance companies to make any money on this. People were getting in, buying health care insurance when they got sick. There's the issue with no pre-existing conditions being something that they're brought against them as from an insurance perspective. But when you get rid of the mandate, which has been a huge complaint for people, that means that you are going to continue to have people who are sick buying insurance, not necessarily have the healthy people buying in. And I don't understand how this is going to make it more attractive to all those insurance companies, why they would buy in under this plan.
Well, it makes it more attractive because they're able to sell something that people actually want. Right now, we have 6.5 million people in this country who have paid $3 billion in penalties so that they don't have to purchase what Washington is forcing them to buy. It's an astounding model that was selected by the previous administration, and it's not working, again, in that individual and small group market. So the reason that issuers, insurance companies, would get back into the market is because they can fashion a health coverage plan that actually works for the people that need to buy it.
Because the Obamacare plans covered too many different things?
Yeah, because it was a one-size-fits-all. It's a top-down model. It's Washington knows best. You buy this, or you pay a penalty. You pay a tax. That doesn't work. That's not the way the system ought to work. The way the system ought to work is to make it so that every single American has access to the kind of coverage that they want for themselves and for their families, and that access is available in a commercial space. That's the way you reconstitute the individual and small group market.
Let's talk about the politics at play here. We've already heard that there are 4 senators who are holdouts on this: Mike Lee, Ted Cruz. You've got Rand Paul and Ron Johnson, who have all said that they're, at this point, can't vote yes for this. But then you also have someone like Susan Collins, who has not said she's going to vote no, but has raised some huge concerns about what this would mean for rural hospitals in her state. If you cap Medicaid payments coming from the federal government, that's going to be difficult for a place like Maine. How do you get to the votes you need? You can only lose 2 senators at this point and still have this pass.
You're right. But you got to work through all those issues, and this is a process, and you all know this. And when you look at a snapshot in this process, sometimes it looks pretty, sometimes it doesn't look so pretty. But what we're doing is reaching out to every single senator and making certain that they have comfort level with the piece of legislation, knowing that it will improve. It's called the Better Care legislation, and that's what we're interested in making certain happen. It's important that you mention Medicaid, because Medicaid is a program right now for those in the lower income area, and the fact of the matter is that Medicaid has 1/3 of the physicians in this nation who can't or won't see Medicaid patients. And not because they've forgotten how to take care of them, it's because the system isn't working. So we want a Medicaid system that actually works, and we believe that the construct that the Senate has brought forward is one that will do that.
Mr. Secretary, the American Hospital Association Association, the Federation of American Hospitals, America's Essential Hospitals, the American Academy of Pediatrics, the American Association of Medical Colleges, you know where I'm going with this, all have condemned this bill. Let me just read something to you and have you react. This coming from the American Essential Hospital saying, today's Senate bill makes few material improvements to the deeply damaging House legislation and might be worse overall. For the hospitals that protect millions of Americans and their communities are essential hospitals. This bill might even accelerate decisions by some to reduce services or close their doors.
Well, two points. One is that the current system is making it so that they have to reduce services and close doors. You read it in small community papers all across this land. Hospitals are remarkably challenged. The second point is that what the premise of that point is that the bill is all that's being done. The fact of the matter is that the bill is a significant portion, yes, but it's not all that's being done. Right here at the Department of Health and Human Services, we're working with hospitals, we're working with physicians, we're working with other providers to make certain that we're decreasing the regulatory burden, that we're decreasing the difficulty that they have in caring for the patients across this land. And when you look at it in its entirety, this is such a better move from where we currently are in a system that is failing
Mr. Secretary,
patients.
if this is such a better move, why aren't we seeing more support for this from those same groups?
A couple points. One is that people assume that where we are right now is going to be able to continue. Fact of the matter is that it won't. As I said, the individual and small group market is collapsing, and Medicaid is a system that's not able to care for the patients in that system right now. The second is that change is difficult. The unknown is difficult. But what I will tell you is that the fact of the matter is that the president is absolutely committed to making certain that every single American has access to the kind of coverage that they want for themselves and for their family, not that the government forces them to buy.
I mean, there's winners and losers in Obamacare.
Sure, there are.
I mean, obviously.
And
we know
the problem is that many
the hospitals are like on the top of the list for the winners. So I mean, that's not surprising at all. Let me ask you this though, Mr. Secretary. There were some senators, probably from states that aren't that solid in terms of red versus blue, that wanted to avoid the whole taxation issue because they're ready to, I don't know, roll over the minute someone says you're redistributing wealth from the poor back to the rich. How are you gonna counter that argument? Because that case can't be made. Whenever you cut taxes, obviously, since a lot of taxes are paid by people in higher income brackets, whenever you cut it, you're going to hear that you're redistributing it from the poor to the rich. And you're not going to be able to say that it's going to help small business and it's going to help the economy. That probably won't do it. How are you going to convince people that this isn't heartless and a redistribution to the from poor to rich?
Well, remember, all those taxes that were put in place by Obamacare, trillions of dollars in taxes, were taxes to pay for a system that doesn't work. Doesn't work for families. It doesn't work for patients. It doesn't work for docs. Doesn't work for employers or employees. Doesn't even work for states or the federal government from a financing standpoint. So when you remove all those taxes, which is what the bill is attempting to do, and put in place a more efficient system, a more effective system, a system that's more responsive to the people actually using it, the docs and the patients across this land, that's a system that the American people will embrace.
Those taxes, at least the 0.9% tax on payroll tax, that in this bill won't be rolled off until 2023. Is that the more likely scenario versus the House bill, which would roll them off this year?
Well, when you get to the specific taxes, then you get to what it takes to pay for the bill as it's constructed and what the score is going to be. That's the folks watching your show know that that's the language that comes out of the Congressional Budget Office. So that's a balancing act and just making certain that the numbers work. But the important point, again, is that as you decrease taxes, you increase the accessibility and the affordability and the choices that the American people have in terms of health care with this piece of legislation.
Mr. Secretary, the attitude of the country has probably changed. 7 years ago, maybe people didn't think it was a birthright that everyone should necessarily have health care. That has changed, though, and I think there probably a majority of voters would say you don't want anyone to lose coverage, and what the card that's going to be played is the Medicaid card, even though it was designed for poor mothers and disabled children. It's now being used for healthy men that are not even in the poverty level. So, but if you rein it in, you're taking away health coverage, and that's going to be the hardest thing to. It's going to be the hardest thing to sell, to You're going to hear it from the media, and you're going to hear it from the Democrats.
And from one of the senators who calls it mean and meaner. These two
mean
bills.
and meaner. Yeah.
Couple points. One is that you've got 28 million Americans right now who don't have health coverage. That's a system that's not working for those 28 million. It's important to appreciate that. In addition, the Congressional Budget Office said that there would be 23 million new individuals who would have coverage. In fact, that's about 10 million right now. And so, again, the system currently isn't working. In terms of the Medicaid individuals, what we want is the opportunity for those individuals to have coverage, one, that they want, and that may be in the Medicaid system. It may be in a system in that individual and small group market that is actually repaired and improved so that the kind of coverage that they're able to get in that system with the subsidies that are present in the piece of legislation are more responsive to that individual, as opposed to a Medicaid system that oftentimes doesn't work for patients.
If the Senate blows this, and Congress in general blows this, is it single payer? Are we headed hurtling towards single payer?
Well, I sure hope not, because again, that's doubling down on a system that hasn't worked and won't work, because that's a top-down model. That's Washington dictating to the American people what kind of health care they will receive. I don't think the American people want that. I know they don't want it when I go out there across this land and talk to them about what needs to be done. This is kind of messy in the middle of it, but I believe we'll get through this and we'll get to a point where we actually move in a much better system that puts patients and families and doctors in charge of health care.
Secretary Price, thank you for your time this morning.
Thanks so much. Take care.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.